Okay, very good. I'll get started. If the others joining will be able to get on and follow us. So welcome and thank you for joining the Women's Issues segment of the Massachusetts League of Women Voters Legislative Action Committee meeting of the Specialist Series. Human rights are being challenged aggressively at the federal level. Most of us are experiencing some level of shock and disorientation, and many of us are discovering that fighting back is necessary to keep our sense of equilibrium. One way of doing this is to pass laws that protect women who live in our state and those who visit here for needed health care that may not be available where they live. This afternoon, I'll be presenting 7 bills that relate to women's health care, including abortion. We are fortunate to have Representative Lindsay Sapadosa with us today. She is a lead sponsor on 3 of our women's health care bills. Rep. Sabadosa has a long and interesting resume. I wish I had time to mention all the details, but I've chosen some of the highlights that are most related to our topic today. From an early age, she supported women running for office and has continued to mentor young women. She's a longtime champion of reproductive justice and has volunteered for the Planned Parenthood Advocacy Fund of Western Massachusetts for many years. She's on the board of the Abortion Rights Fund of Western Massachusetts, and she is a founding board member of the Doula Association of Reproductive Loss and Abortion. She has supported women's marches since 2016 and created the Pioneer Valley Women's March, which is still active today. She has a strong and independent voice in our House of Representatives. Please join me in welcoming Rep. Sabadosa. How about some applause? Thank you.
That's very kind. Thank you so
Great.
much.
So
Um,
I've got a couple more sentences and
oh,
then I'm
sorry.
going to, no, that looked like your cue. Excuse me there. Rep. Sabadusa is a lead sponsor on the first 3 bills I will highlight. After I describe each bill briefly, Rep. Sabadosa will have the floor to say something about why she created the bill and how much support the bill has. Then we'll pause for your questions. So can I have the first bill slide, please? All right, our first bill is an act promoting and enhancing the sustainability of birth centers and the midwife workforce. This bill will enhance last session's Birthing Justice Omnibus Bill that was passed into law. The Omnibus Bill expanded access to midwifery care, birth centers and home births, and much more. The Birthing Justice Omnibus Bill was passed unanimously in both the House and the Senate in response to the unnecessary poor outcomes for birthing parents and their children, especially among the Black population. So this bill establishes a midwifery workforce development fund. It requires fair reimbursement for caregivers. It enhances birth center sustainability, and it creates a community birth data registry for Massachusetts. The Bay State Birth Coalition advocates for this legislation, and currently there are 26 co-sponsors in the House and 14 co-sponsors for the Senate. So Rep. Sabadosa, we'd love to hear why you created this bill and anything else you'd like to say.
Great. Well, thank you again, and thank you for the lovely introduction. That was overly generous. So, this piece of legislation is super important to me. I represent Seven Sisters Birth Center, which is located in Florence, Massachusetts, which is part of Northampton. They are currently the only freestanding birth center that is in full operation in the state. Now, there are others that are in the works, but they are there and they are serving patients, and it is extraordinarily and unnecessarily difficult for birth centers to remain open. The fair reimbursement piece that you see here is absolutely critical to their continued success. The same rate the same services that might be provided at a hospital are paid at a higher rate than they are paid to the birth center, which means the birth center loses money on every single birth that they oversee. I guess there's probably a better word for that, but I'll go with oversee. And so we're in constant contact with Seven Sisters. We've tried to find many ways in order to help them, and we'll continue to do that. But this legislation would put into statute that there must be fair reimbursement, and then of course it helps reduce regulatory barriers and fees. I can tell you, I have walked through Seven Sisters, and I have seen equipment that they have never used but were required to purchase because DPH decided that they needed it, even though it was not germane to the services that they offer. So we need to, do more work on the mid. We need to build on rather the work that we did last session and really get into some of these nitty gritty details. And while I keep talking about Seven Sisters, we know Neighborhood Birth Center wants to open in Boston. We know that there is a birth center, I believe it's called Warm Welcome, that's planning to open its doors in Worcester. If we can pass this bill, we make the path that much easier and more successful for those other birth centers. I mean, this is really about having a choice in where one gives birth. And if you ever have the opportunity to come to Seven Sisters, it feels like you're giving a warm hug the second you walk through the door. It's a lovely choice for many families, and we want them to have that option. So this bill will keep them in business and it will allow others to open.
Fantastic. Thank you for that. So, do you have questions from the group? We don't have a huge group, so if you unmute and raise your hand, we'll call on you.
It's an easy
I
group.
don't,
There seem to be no questions.
I don't see any questions. All right,
I have
so
a
let's go.
comment.
Sure.
Oh, great. Comments work.
Both of my grandsons were born in a birth center
Oh.
that's no longer there, and I don't know I think it was called the Birthing Center. It was on Worcester Road. There's other medical things in there now. But it was an awesome experience for my daughter and for all of us who were there.
I hear that so often from people who've had the opportunity. And I think 30% of births that are uncomplicated could easily be accommodated at a birthing center. So we're hoping that they expand and people have that wonderful opportunity.
Yes. And if I may, I just want to underscore, I mean, Seven Sisters is located in Florence in Northampton. They actually serve people from across the state. You have families who choose to give birth in Northampton, even though they don't live anywhere nearby. And they serve residents in Vermont, Connecticut, and New Hampshire as well. And they have made the commitment that over 50% of their patients are going to be mass health patients. They want to make sure this is not just a service reserved for those who can afford it, which is why they struggle so much with reimbursement.
Okay, all right. So let's move on to the next bill. Great. So this one is an act ensuring access to full spectrum pregnancy care. And Rep. Sabadosa and Senator Freeman sponsor this bill. It requires all public and private Massachusetts health insurance plans. I think not the ones that companies have as private though, right?
Yeah, not self-insured plans because of course
Right.
those are ERISA plans. We can't affect them.
Yeah. To provide coverage for all pregnancy care with no deductibles, co-pays, or other cost sharing. So that's before birth, during birth, and after birth,
That's right.
the whole spectrum. Reproductive Equity now advocates for this bill. It currently has 30 co-sponsors in the House and 9 co-sponsors in the Senate. It was a new bill last session, I believe, and it was reported out of committee and then died in the Senate Ways and Means Committee. So we'd like to hear your perspective.
Sure. So this bill it was actually not new last session, but it was rewritten last session because we filed it. We filed it my first term in office, so that was 7 years ago, and we've passed parts of it. So we've shrunk it down to remove the pieces that we were able to get. And actually, I love this bill because as you mentioned at the beginning of this conversation, I work with the Abortion Rights Fund of Western Massachusetts. And in that work, one of the things that I noticed was that we were getting a lot of calls from people who had insurance, and insurance was paying for part of the procedure, but they could not afford the copay or deductible. And so it felt really silly that the fund was having to step in and make up this difference when, I mean, $200 may not seem like a lot, but for some people, it is really the question of, can I pay rent this month or not, or send my kids to daycare? And so I had reached out to Reproductive Equity Now, and I said, I think we should file a bill where we get rid of copays and deductibles for abortion care, because it's, it's really causing a huge problem. It's putting a lot of people in our state in a really difficult position. And they said to me, there is no way we can pass a bill that gets rid of copays and deductibles for abortion. We should make it full spectrum because that will make it more palatable for legislators. So, just interestingly, the parts of the bill that we did pass were eliminating copays and deductibles for abortion. We got that passed first. And then we moved forward and we, of course, eliminated copays and deductibles for mass health. And now we are looking to do all private insurance. So we've got little steps along the way. The biggest pushback we get against this bill is that it's going to be really expensive. Insurance companies act like the world will end if we pass it. But thanks to Senator Friedman's good work, we have a CHEER report showing us how much it would cost, and we're looking at some enormous cost of 21 cents per person per month. So it is not a bill that's going to send your premium through the roof or cause everybody to not be able to afford insurance. But really, I think it's so important to drive home. People ask all the time, why aren't people in Massachusetts having more kids? Why are people, choosing to maybe just have one or to have none? And part of the reason is that people don't want to go into medical debt when they give birth. And we're seeing that happen to families, that they had no idea that going to the hospital and having their baby, particularly if there are any sort of complications, could mean that they're starting off life with a newborn with huge medical bills that they have to pay. And so, if we want to encourage people to have families and we want to be equitable in how we provide coverage, then this is something that we really should be doing. And it is not an expensive piece of legislation. So Senator Friedman and I are very committed to this bill. I think we are going to continue to chip away, and we're going to get the whole thing over the finish line, because it's just really important. And there are too many stories every year when people come to testify of just real pain caused by medical debt.
So are you seeing quite a bit of support in the Senate and the House?
Yes, we are. And in fact, we usually get a lot of co-sponsors around this bill. It sort of grows now that you don't have to co-sponsor everything in the first few weeks. It slowly grows over time, and it's really been exciting to watch.
Fantastic. All right, I see a hand raised. Cleo, would you like to ask your question now?
Sure. I was just wondering, is the reason why it died in the Senate Ways and Means specifically due to the cost, or were there other factors that contributed to that?
There were other factors. So really, I think it became a question, and we did talk about trying to include it in the maternal health bill, but I think when we get to the end of session and we're focused on what are we going to actually pass and get over the finish line, that maternal health bill became the priority. And so it was really all hands on deck. And if you remember what that was like, we got a House version, we got a Senate version. There was a bit of loggerheads at the end of session, not because of maternal health, but because of other bills. And so it was just something that I don't think we were able to get to rise to the top. But I think we'll get it moved forward again this year. And like I said, I think it's going to be a chipping away process where by the end, there'll just be so little left that it will make sense to pass the whole thing.
Thank you. So Carol, how about asking a question now?
Yes, I have a question about the full spectrum pregnancy care. Does that include getting pregnant, the in vitro fertilization process, for example?
Oh, that's a really good question. I'm trying to remember if we included it in the bill. I'm not, I'm trying to remember if we did or we didn't. I'm going to have to respond to that afterwards, because we went around. There's a very good bill that will cover that it would fully recover IVF. And I'm trying to remember if the strategy at the end was let's keep it separate or let's all put it in the same bill. So let me check so that I don't misspeak.
Thank you.
But we have worked very closely with the coalition around IVF.
Okay, good. Any other questions or comments? Perfect. All right. Next slide, Jen. Thank you. So the next bill is an act prioritizing patient access to care. Rep. Barber and Sabadosa and Senator Kennedy are sponsors. This removes restrictions on abortions after 24 weeks. Abortions may be performed based on the professional judgment of the physician along with the patient. We now have a law that stipulates when you can have these abortions. So this would just remove any ambiguous language that possibly could be used in a court of law in a way that it wasn't meant to be used. So Reproductive Equity now advocates for this bill. There are 29 co-sponsors in the House and 6 in the Senate. And this is a new bill this session.
So it's a new-ish bill. This provision was included in the first version of the Roe Act. The Roe Act was passed, let's see, in 2020. And that bill was, I think, sort of the first really, really big abortion expansion bill that the legislature took up in the wake of Justice Ginsburg's death, sort of trying to be proactive in what we might have seen coming from the federal government. The Roe Act had 2 provisions that we didn't include in the end. This was one of them, and the other was around judicial bypass for minors, removing judicial bypass for minors. This piece is tricky. There were a lot of legislators who were very nervous about the whole idea of later term abortions, and we just weren't able to include it. However, we came back to the issue in the SHIELD law that we passed the next session. And we came back to the issue because we found that the language we had included in the Roe Act, which sort of said, if there's fatal fetal abnormalities, then or severe risk of death of the pregnant person, that you can perform an abortion. We found that the language we used was still too restrictive. And we had an amazing woman who came forward to share her story of having to travel to Maryland to have the abortion performed. And because it was a later term abortion, then came back to Massachusetts in order to deliver. Had to travel by car from Maryland to Massachusetts to come back to the state. It was a horrific experience. It was a very, very desired pregnancy on her part, but her hospital in Massachusetts told her that based on the law we had written, that her fatal fetal abnormality, I think they said, well, there's a 1% chance the fetus might live, and therefore we can't do it. And so we learned a lot about hospital administration and boards and hospital attorneys and how they were interpreting the law. And we really wanted to change it. And so we did in the SHIELD law, and we changed it to say severe fetal abnormalities and of course, endangerment of the life of the pregnant person. And yet, we find that once again, hospitals in Massachusetts are forcing patients to travel out of state. And I know this personally because, again, I still answer the phone for the Abortion Rights Fund of Western Massachusetts, and we hear the cases of patients who say, I was told that this maybe isn't severe enough. and so, this is really fundamentally and it's not the doctor that's saying this isn't severe enough, it's the hospital administration and their attorneys who are saying we can't risk being sued, and they would be sued by anti-choice groups in the state if we perform this abortion. And so we're seeing patients travel out of state. We're seeing patients travel out of state now in this moment of states trying to criminalize travel through their states for people seeking abortion. Now, we know that's unconstitutional and illegal, but even so, it feels wrong to ask anyone in Massachusetts to leave our state for care. In fact, we want just the opposite. We want people to be able to come here and get care. So this removes restrictions after 24 weeks. We are talking about a very small number of people, but it's very powerful. It would allow Massachusetts to become the beacon that we want to be. And it would mean that our patients just get care in their hospitals or clinics. We would, of course, it's based on professional judgment of the physician. That is the exact same language that they use in Maryland. There are very few states that allow, well, there's very few states that allow abortion, but there are very few states that allow later term. The last clinic that did in Colorado just closed, but we still have Maryland, DC, and I think New Mexico was on the list. I think they're still on the list. And we had, last I checked, one physician in Washington State. So if you have a severe issue after 24 weeks, your options are limited. Massachusetts should be on that list, and that's what this bill gets at.
Terrific. So any questions or comments? All right, well, we really hope that one passes
I have
as
a
well.
question.
Oh, go ahead. Mhm.
Sorry. Hi, I'm Ann Carter. I'm new to the League of Women Voters. I have a question on the part, whether the support for these bills are partisan a little bit or anti-partisan or not.
Yeah.
That's not a good way
Hi,
to.
Ann. Hi, Ann. This is Jennifer Miroff. I'm the Legislative Action Chair for the League of Women Voters of Massachusetts. So we're nonpartisan in that we don't endorse political
Oh, no,
parties or
I know,
candidates.
I get that.
but
I didn't ask the question really in a great way. I
Okay.
guess I meant like, are you getting support on both sides of the aisle for these? Or I'm just wondering, because I mean, I guess, most Democrats probably would support things, but folks?
So for the full spectrum bill, we have bipartisan support. I think that's a pretty easy one for folks to understand. Midwifery bill, exactly the same, bipartisan support. For the removing restrictions or the patient access bill, I don't know that we have bipartisan support in our co-sponsorship yet. I will tell you, and I don't know that, everyone would say this, but we absolutely have pro-choice Republicans in Massachusetts, and we absolutely have anti-choice Democrats. So if you look at past votes, I mean, the Roe Act, I believe we had Republican support on the Roe Act. We absolutely had Republican support on the Shield Act. It was a near unanimous or very close to vote. So I know that nationally and the popular discourse around abortion is that it's like red versus blue and that's the fight. That's not really the case. And I will say Reproductive Equity Now did incredible polling talking to residents of Massachusetts about their views. And really across party lines, people said, I don't want anyone traveling out of state. And even most Republicans say they don't want abortion to be restricted. So once we get out of like the MSNBC, Fox News bubbles, like the reality is that most people are very reasonable about what they think should happen. So we just need to stay within that discourse. The reasonable, this is about access to health care. If this were your family member, what would you want to have happen? And, there's always outliers, but most people say, let them go to our local hospital and get the care they need.
Thanks. That's good to know.
Yeah. I know it's much more uplifting to hear like what is happening.
Oh, thank you, Rep. Sabadosa. This is Jen Miroff. I wanted to point out Jan's going to discuss it, the Location Shield Act,
Yep.
which is lead sponsor, does have a Republican sponsor, and
Yes.
that is related to abortion care as well. So, yeah.
Absolutely. And David Vieira, the lead sponsor, or one of the lead sponsors of the Location Shield Act, he, got up and gave a really impassioned speech about let people live and let live, and privacy should be a right. And that's not it shouldn't be partisan. Also, David Vieira is awesome, and I really enjoy just working with him in general.
All right, excellent. Any further questions? All right, well
I
then
do have I actually do have a comment though. I
Oh,
just
go
want
ahead,
to say,
Jen.
I wanted to be impassioned in this response, which is thank you from all 3,000 members of the League of Women Voters of Massachusetts, from Cape Cod to the Berkshires where you are, 155 municipalities. We are so very grateful for your work in abortion rights. We have been abortion rights supporters since the inception of abortion rights. So we just want to thank you from the bottom of our hearts for all you do to protect the health and safety and human rights of all people in Massachusetts.
Thank you. I appreciate that. And I feel the same about the League. I'm very grateful for all of the work you do. Also, your events are the most fun. I love going to our local League events.
Okay, good. All right. Well, then we'll move on to the two shield bills we have, and it's a natural segue here.
Should I sign off then, or do you need me to stay, Jen?
No, we'd be happy. Well, how would you like to do it? If you'd
Oh.
like to stay on, you're very welcome. We have several more bills, but if you are busy and would like to sign off, you're welcome to do that as well.
I'm actually at a healthcare for all briefing, so I'm gonna go back to that. They kindly put me in a little office so I could chat with all of you, but I will go back and hear what the federal government is gonna do.
Okay.
with
Well,
healthcare.
thank you.
All right, thank you, everybody. Have a good rest of your day.
Take care. Bye
Thanks.
bye. Well, she's inspiring. So glad she could take time to be with us. So we have a couple of shield bills, and I want to introduce them as together. Although many states voters have pushed back successfully to retain abortion rights, we also know that law enforcement in other states strive to get information about pregnant people who have crossed state lines in order to prosecute them or their caregivers. These two shield bills not only protect patients and caregivers in Massachusetts, but those who travel here to receive care as well. The first one, let me see, could you put up SD 2808? Thank you. This bill is the first product of our state's Response 2025 initiative. The Response 2025 initiative focuses on assessing federal actions to determine their real-world impact on Massachusetts and on identifying policy solutions to mitigate potential harm and safeguard residents. So our Senate, at least, is working on pushing back against federal initiatives, and this is a really important one to do that. So it's sponsored by Rep. Lipper Garabedian and Vieira and Senator Crane. It prohibits the sale, lease, or trade of Massachusetts cell phone location data. And this protects reproduction, people who come here who could be monitored about where they are in Massachusetts. If they go to an abortion clinic, that could be information that police or agents from another state would want to have. Survivors of domestic abuse, immigrants, public figures, activists, all of us, it's easy to buy this data. And we probably don't want anybody to have it besides our loved ones who may want to know where we are if we're late for coming home for dinner. So it's reported favorably already. It's a Senate bill that was already reported out of committee, which means that there's an awful lot of energy behind it. So can I see the second slide, Jen, please? So, oops, no, let me see the one. Could you go back? An act strengthening health care protections in the Commonwealth. Oh, no, we just did that. This is an act to protect location privacy.
Wait, Jan, I do apologize. I
That's
thought,
right.
I do
Good,
apologize. So we did SD.
If you just
Yep.
go back, let me see. There you go, right there. Thank
Okay.
you. I think they were in different order than I expected. So this one it's the same bill, but it's got two names. It's got a House version and a Senate version. The House version is an act to protect location privacy. The Senate version is worded differently, an act to protect safety and privacy by stopping the sale of location data. All right. All right, now I need the other one, the SD 2808.
Got it. Right here.
Perfect. Okay. So this is Senator Friedman, and this bill improves and expands on the abortion shield law that was passed in 2022. I'd like to say that our state has been very proactive in passing the bill in 2022, but it was passed quickly. They used the policy information that they had at the time, but with all kinds of things changing, and dangerous interference popping up across the country. It's been improved by adding a lot of different elements. It creates a protective legal framework that defends patient confidentiality. It does things like having anything to do with reproductive health care having to be separate from the patient's record and not accessible unless the patient gives permission. It shields healthcare providers from undue external scrutiny, so the healthcare providers are not identified either, and that protects them. Ensures the essential reproductive and gender affirming services remain accessible and free from discriminatory practices. So this bill protects gender affirming care, and that wasn't explicitly mentioned before in the bill. So this is a bill that was it did in the beginning of each session, 2-year session. Bills typically just have a number of weeks to be filed. But later in the session, bills can be filed. It's just not typical. So this is a late file bill. It only has 6 co-sponsors. However, that doesn't indicate the degree of support. We expect that it's going to have a lot of support in both the House and the Senate. So these are 2 shield bills that are being taken together. If you have any questions, I'll try to answer your questions on these bills. Eileen? There you go.
Thanks. If these bills should become law, how would they supersede federal legal restrictions?
Well, that's a really good question. Typically, if there's a federal law that covers the same territory, the federal law has to be used. However, I'm not an expert in federal law, but what is being done in some states, and Massachusetts is leading the way, is we're trying to get things into the law that aren't explicitly stated in a lot of federal laws. So we then would have a law that isn't reflected in a current law at the federal level that would erase the law that the policy in the law that we passed. So these, things are happening so fast in the healthcare and abortion realm that all kinds of states have all kinds of different laws. And we can feel good that some states are pushing, the citizens are voting to keep abortion in their states. But you can see the logjam that's happening in our federal government in the House and the Senate. So we want to get ahead and have a law that protects our people. If they pass a law that supersedes it, we're not going to be happy about that. But these laws are meant to take effect soon and protect people for as long as possible. And hopefully we won't have federal laws that take away our rights. Thank you for that question. It's a really good one.
Thank you. I have one more question then. Can we attain the PowerPoint presentations? This present.
Jen Moruff is going to send that out to everyone who participated. So you'll have that in your inbox. She's really good about getting that out quickly, along with the recording, the video recording.
Thank you.
And feel free to share it with others who may not have been able to be with us today. Okay, anything else before we move on? All right, terrific. So I have, my next bill, I have an act relative to healthy youth. There you go. This bill is really near and dear to my heart. It has been filed since 2015, and it was refiled in 2017. And then in 2019, nothing happened the first two sessions. In 2019, it passed in the Senate 33-2. In 2021, that session, it passed 38-1. In 2023, it passed. I didn't. I think they must have done a voice vote because I don't have numbers. So the last three sessions, it passed with strong Senate support. It then went to the House where it died. So let me tell you something about the bill. And in a way, I wish Lindsay Sabadosa could have been with us because she's in the House where it hasn't gotten support. So that's something that we really want to work on as a league to get support in the House. So Rep. O'Day and Howard are sponsors in the House, and Senator DiDomenico in the Senate. I've got to say, Rep. Jim O'Day is passionate about this bill and is a wonderful spokesperson. If you ever get a chance to hear him speak, he's wonderful. This bill sets standards for sexual health education, which must be medically accurate and age appropriate for public schools that teach sex ed. It requires that the curriculum meet the needs of all students, regardless of gender, race, disability, status, sexual orientation, or gender identity. The content must span topics including consent, in other words, when figuring out when you have consent to touch another person sexually, human development, anatomy and reproduction, abstinence, contraceptive use, gender identity, and sexual orientation. Parents may opt their children out of the class, and the children are not supposed to get any penalties at all. So they could do that hopefully comfortably. There are 23 co-sponsors in the House and 11 co-sponsors in the Senate at this point. The Healthy Youth Coalition advocates for this bill and has many co-sponsors, including the League. So I'd like to add that last session, our state education department revised its outdated sex education curriculum. It has been widely praised for its comprehensive and age-appropriate materials. However, public schools that offer sex education are not required to use this or other scientifically correct curriculum. So the Healthy Youth Act is still very much needed, even though they updated the materials that schools can use. They don't have to use them. We know that youth are getting a very confusing message about sexuality. They're using online sources that don't emphasize usually healthy sexual interactions. So I really, really want our kids to have this opportunity. So questions or comments? Eileen.
The question I have is, would this act apply to public and private schools?
Fortunately, it's just public schools. I'm hoping that the private schools are free to use the new curriculum. It's age appropriate, so for the younger people, they've got, it's all stepped with regard to being age appropriate. They can use it. I hope they do, but the state can't mandate that they do that. Okay, so I'll move on to our final bill then. This is an act to increase access to disposable menstrual products. These bills were first introduced in the 2019-20 legislative session, sponsored by Reps. Livingstone and Barber and Senator Jalen. These bills increase access to menstrual products without cost in prisons, homeless shelters, and public schools. Access to sanitary napkins, tampons, and underwear liners must be available conveniently and without embarrassment. There are 42 co-sponsors in the House, which is a pretty high number for the House, and 20 in the Senate. The Massachusetts National Organization for Women advocates for this bill and has many co-sponsors, including the League. In the 2019-20 session, the bill was sent to the Senate Ways and Means Committee, where no action was taken. However, in the next two sessions, the 2021 and the 2023, our last session, the bills came up for a vote in the Senate and passed unanimously. So whoever was talking about the different parties, but the Democrats and the Republicans came together and voted unanimously. They were sent to the House and no further action was taken. We hope that the House moves the needle this time. That it's not uncommon that bills pass in the Senate and then they go to the House to die. I'm particularly frustrated about the last bill. It's come up so many times and the House hasn't even considered it. And this looks like it's moving in that direction as well. So in our advocacy, we really are going to focus on people in the House to try to get those numbers up. So any questions about this bill? Yes, Anne?
Hi, yeah. So when you say it dies in the House, could you just say more about that? I guess I don't totally know what that means.
Well, okay, so generally what happens is that there are unusual circumstances, but usually a bill that's passed in the Senate then is sent to the House Ways and Means Committee. The House Ways and Means Committee then looks at the bill, and if they feel it has enough support, then they can move it on for the House to consider a vote on that bill. When bills go to different committees, a joint committee where the first place that a bill goes is a joint committee. That joint committee can change the wording in the bill if they want to, and then they can pass it or they can not pass it. But this bill was voted out of committee. It was sent to the Senate Ways and Means. The Senate Ways and Means may or may not have changed its language. I don't remember. And then it was sent to the floor for a vote in the Senate. So then that bill then goes to the House Ways and Means, and they go through the same process. They can change the wording, and if they believe it has enough support. In the House, the Speaker reigns. The House Speaker has a lot of power. So in conjunction with the House Ways and Means, he probably gives the go-ahead for bills that are coming to the floor, almost certainly. And he was not interested in having this bill go forward last session, and that goes for healthy youth as well. So we hope he has a change of heart, and if we advocate with enough House members who become interested and they speak to him, maybe we'll have a different outcome. Thank you for that question.
Well, thanks for explaining.
Any other questions or comments? Now, I could mention a quick comment about my town, Needham. We had an 8th grader who advocated for menstrual products in the schools, and she actually went to the powers that be, and the town found some money in free cash, and her advocacy meant that our town is a fairly wealthy town. So maybe another method would have been discovered if she hadn't done it. But young people are advocating for this particular bill at high rates. And it would be lovely if they could be supported by having us pass this bill into law. They would feel like they really made a difference.
Awesome.
Hi, it's Freddie. I think this is so important. I think, you know, we all grew up expecting that that was our responsibility, and yet we certainly expect public places to provide toilet paper. And it's just outrageous, you know? So it's really terrific, particularly that young people are figuring out and understanding that these are rights that everybody should have. And so it's wonderful. Best of luck with this. That's great.
Yeah, thank you for that comment. And what I didn't say was that many people don't have the money to pay for these products, and it means that they don't go to school or they don't go to work, um, or they have soiled clothing and they're embarrassed and ashamed, and um, it just isn't right. So you're absolutely right, Freddie, and all the rest of you who support this bill. So
Yes.
let's make it happen.
Thank you. Thank you. You're absolutely right. It's critical. It's really critical to women's lives, to young girls' lives. Thank you.
Right. Eileen?
Yeah, do we know why it was turned down the last time it came forward? I mean, was it a budget issue or what?
Well, that's one of the things that is mentioned. It would cost money. I remember speaking to my House of Representatives person at the time, who's no longer with us, but I mean, no longer in that seat. But she said that it was money. It could go beyond that. I mean, we know that things pertaining to looking after women are not always at the top of the list for some legislators. But she said that the initial cost would be the containers that hold the products, and that would involve some cost. It isn't a huge cost, and the people who the National Organization for Women who are really advocating for the bill have actually looked for other sources to help pay for this. So it's not just money, because they have found some ways to pay for at least some of it, and it still hasn't moved forward. So we need to keep nudging and just pointing out that this is an extremely reasonable, fair, relatively low cost bill that is needed now.
Just one more question on that. When somebody puts a bill like this forward, do they also come forward with a way that it would be administered, or how it would, like, you know, how it would be set up? Or is that like another step that happens so that you could look at cost and feasibility and all that kind of stuff?
Yeah, that's actually a very interesting question, because a lot of bills get passed and then kind of nothing happens because there's no follow-up. Um, we had a bill from last session on pay equity, and I'm glad to say that there's a lot of follow-up at the Attorney General's office on that particular bill. So, but you don't know until after it's passed exactly, it's not part of the bill how it's going to be followed up. It says that the Attorney General can enforce it, but there are laws like stolen wages. It's been on the books for many, many, many years, and that's a common thing for women to have wages not given to them that are due because they work for those wages, and so there hasn't been a lot of follow-up. The Attorney General could do it, but we know that they have so many things that they have to do that they may not always get to it. I think that this one, what would happen is the coalition, the National Organization for Women, would follow up and nudge and nudge and nudge until it happened. So the coalitions that advocate for the bills are typically the organizations that make it happen after the bill is passed. So I think that we're likely to see the National Organization for Women help make this happen. It's a really good question, though, because it can get really confusing. I thought originally, when I started looking at legislation, that if the bill was passed, well, that was it. We're good to go, but that's not true.
And so does it have to become part of the whatever the state budget, and then it gets voted on again there? So it's like this right, we now have this right, but it's not necessarily doesn't actually come to fruition if they don't have the money for it.
Often it would be a line item, I think, in the state budget. But there are other places to get this money. So it's possible that in follow-up, some communities would actually pay for it themselves. I know our superintendent in Needham said that if the free cash that the eighth grader got for menstrual products in the schools in my town, if that was not available, he would find some way to get the money to make it continue because he felt so strongly about it. So I think each community is going to look a little different. But we can imagine that the communities that have tight budgets and not extra cash are going to be the ones that are going to need some help in figuring out how to make this happen.
And just a quick reminder, it depends on how the final bill is written. So it's likely going to change in the first committee. It's likely going to change in Ways and Means. So whatever the language is kind of depends. Sometimes it's a line item in the budget, sometimes it's not. So we have to look at what the final law, when it's, if and when it's enacted, what it states and how, and that will lead to the implementation plan.
All right, thank you, Jen. That's great. Okay, well, let's move to the next slide then. So I would love for you to join the Women's Issues group list. So my goal is to get bills passed into law. And to do that, it's critical to have as much advocacy support across the state as possible. And the league is wonderful since we have people from all over the state, which means so many senators and representatives have constituents in our group. If you would like to be on my list of members who receive occasional bulletins about time-sensitive advocacy, please consider putting your name in the chat. It'd be great to have your help getting these bills across the finish line. So thank you for that. And the next bill, next slide, please. So we're going to, the Massachusetts League is going to have a day on the Hill. There's one of these every session. It's when we go to the State House and meet with our senators and representatives face to face. We put it on your calendar. This is going to be September the 18th. And our ask is to get bills out of joint committee favorably. So the bills that haven't been voted out of committee, we'll be working on getting them out of committee. So that's the first step in making sure that they're in a position to possibly be voted on in this session. So the next slide, please. So here are a couple of resources. We have one question about how the legislature works. And we have a video with Joan Lovely, which is excellent. We also have a video done a few weeks ago about some of our opposed and supported legislation that the Legislative Action Committee supports or opposes. And you will be getting an email so that you'll have access to these links in that email after tomorrow or the next day, something like that. All right, so that concludes our meeting for today. Thank you so much for your interest in women's issues. Together we can have a positive impact on the welfare of women. So I'd like you to take care and have a great afternoon, and thanks again for coming.
Thank you, Jan. That was awesome.
Thank you.